Hello, thank you very much for the opportunity. My name is Ronny Castillo. I'm a doctor, but I'm a doctor in economic sciences, not in medicine. So Maria Laura Jimeno is a doctor, a scientist. She's a biotechnologist. Maybe she's coming soon. And before entering into the topic, I just want to reiterate, a little key terms that I think would be useful before getting into the topic. And it's about the evolution of society in the last maybe 50 years, where we began from a capitalistic, kind of way of thinking into introducing a term that is called sustainability, and that happens maybe after the Kyoto Protocol and after Rio 92. And after that, maybe in early 2000s, we began to talk as a humanity about being resilient, resilience. And lately, maybe 2010 to now, we're talking about regenerative approach, And those approaches are not only related to medicine. I'm also a rebel guy, I have a lot of tattoos. And what I think is that one of the most rebel things you can do is, stop trusting the system and trying into getting yourself aware about the things that really matters, So right now we are seeing a lot of disruption in many aspects of life. One of them is, for example, regenerative agriculture, We're questioning the way we produce our food and how we can have a better way to feed ourselves. There is another concept that is very popular right now, and it's about the regenerative finances and all this crypto thing going on, And another thing is regenerative medicine, So these are my three favorite topics to speak about. So let's speak about regenerative medicine. So regenerative medicine is kind of a new thing in health. It's not even recognized by the authorities in many countries right now. Maybe some therapists does, some therapists doesn't. But what is undoubtedly is that it's transforming a lot what the approach of medicine is being held. I'm from Costa Rica. In Costa Rica, we are tolerant into this kind of therapies, as well as Mexico, where the company that I represent is from, and some other places in Latin America and Europe, for example, Turkey or Middle East. This is something that is booming. In the States, there is some pathways where FDA is trying to facilitate these therapies, but it's not yet mainstream. Understanding a little bit about stem cells, stem cells began when were discovered the embryonic stem cells, potential, and there is a little ethical and legal considerations about this, because it involves fetus, destroying. So we're not going to talk about that, but we're going to talk about a little bit more about, adult stem cells extraction. And adult stem cells are extracted from different parts of the body. You can find it in blood, you can find it in bone marrow, you can find it in fat. And from this universe of adult stem cells, there is two kinds of stem cells that I want to bring into the conversation today. One of them is the mainstream or the cornerstone of regenerative medicine, which are mesenchymal stem cells. This has been in market maybe for the last 20 years, 15 years, maybe with a little more power the last 10 years, And it has a lot of potentialities on how you can treat different pathologies with a different perspective, So, and there is something else that is something new that we are promoting here, and the scientist here, Maria Laura Jimeno, literally wrote a book about this. There are like the Muse-AT. Muse-AT are a special kind of stem cells that are pluripotent, and we're going to talk about the difference of multipotent and pluripotency, a little bit soon. But the important thing here is that there is a lot of potentiality on regeneration of tissues, you know. So this been applied, especially the mesenchymal stem cells, been applied a lot in mesenchymal tissues, that's bones, cartilage, you know, skin, heart, regeneration of organs. But they're not that effective into neurodegenerative diseases, which MUSE-AT are, you know. So they are like complementary stuff. You cannot say one is better than the other. It depends on what are you treating, you know, what you want to accomplish with. So there is also another appliances for these kind of therapies. For example, diabetes is one of things that are being researched a lot. As I told you, bone and cartilage repair. And there is a big promise on anti-aging. This is one of the big topics of the world right now. And I don't know if you are aware, but you know there is $100 million prize in California for the guy or the company that you know unlocks the potential of anti-aging. And for sure, stem cells is one possibility here. So let's speak a little bit about the mesenchymal stem cells, which represent the cornerstone on regenerative medicine. And this is because it has more time on market and also has a lot of more research and investigation related to different pathologies, you know. So mesenchymal stem cells are very good because they have been matured and they are extracted and sourced. There is a lot of versatility on applications related to this specific therapy. And there is a lot of clinical applications that have been documented in the last 15 years. So right now, if you go to maybe 95% of stem cells clinic applications, what they're going to give you is mesenchymal stem cells. And they are very, very good. We also sell those, so. And this is a new kind of product, the MUSE-AT. The MUSE-AT has the difference between the mesenchymal stem cells that they are pluripotent. The mesenchymal are multipotent. You know, that means that differentiation they can achieve is different. The mesenchymal is more in mesenchymal tissues. When we speak about MUSE-AT, because of different technical reasons, one of them is the size. You know, is maybe 8 to 15 micras versus 20 to 30 micras on the mesenchymal stem cells. That means that they can pass different barriers that the body has. One of them is the lungs, for example, or the encephalocranial barrier. That means that if they can pass those barriers, they can go to the brain. They can treat neurodegenerative diseases like, for example, Parkinson. And that's very important because Parkinson is a disease that is very popular in the States right now, and there is a lot of research investigation related to this. What is very interesting about this is that we have actually held a research in Costa Rica with 40 patients with very good results in Parkinson. A publication is coming very soon related to this specific therapy. And what I can tell is that we are not trying to substitute at all, the treatment that the people has currently, but they want to complement them and see results. And the results have been very promising in this specific pathology. There are here some clinical studies, case reports, publicated in official magazines that are, globally respected related to this specific MUSE-AT. We are, launching the sale of this new therapy just this year. So we're very proud to offer this to different doctors, and we have a very limited availability of the therapy, but right now has been very successful on the collocation and on the applications that we have. Let's speak a little bit about the anti-aging properties of stem cells. And this is because, many people or the previous way of thinking was like, plastic surgery, look good on the outside, because we like what we look. But right now we're thinking more on healing the inside, and if you heal the inside, you can look good at the outside also, So that's the thing here, tissue reparation. And chase the cellular function, work on these telomeres and all these keywords, that are being talked about this right now. And it's very important that there is not a magic trick here, There is not a magic recipe to be young forever, What we are promising here is not that you're gonna live for 200 years. What we're trying to promise is that you're gonna live well as you are alive. So in order to achieve that, it's not only to apply stem cells and forget about it, it's about to having a wellness approach. It's about having a balanced life, So there is no magic recipes, stress management, eat well, adequate sleep, make exercise, It's plain vanilla recipes, but they work. And they work if you complement it with the right medicine and the right lifestyle. So that's the message that we have to give the people today here. There is also something very important that I think that is the key thing about the importance of having this kind of research right now, and is that the health systems are, collapsed. We know that not only health systems, but also pensions are collapsed. And we are living in a moment of humanity where we are getting old at the same time. So the overall aging population, average, is making that having a lot of stress into the system. And we cannot rely that we're going to have a pension, or we cannot rely that the health system is going to treat me the way that I want. So that's why it's very important to find ways on how we can take out the pressure from these health systems. And stem cells is one way of achieving that, because the idea here is that how we can get old together healthy, at the same time. So we cannot gonna give that pressure into the health systems. And this is the key topic about here, how we can make a way of being more healthy, of being more conscious about how we eat, on how our body, behaves. But we are a machine, a biological machine. So we have to give the good resources to that machine in order to achieve that thing, Otherwise, we're gonna be in a big trouble in maybe 20 or 50 years as a humanity, So I really think that the preparation that we should have as humanity for an aging population is key in order to have peace, in order to live in a way that make us proud as a humanity. And that's the big promise of stem cells. It's not only, healing this or that, but trying to, get a wellness approach in humanity and in communities, And to achieve that, I think it's very important to be conscious of ourselves and not rely exclusively on how the health systems and the food systems are built, because they are built to get us sick, They are not built to get us healthy. So I am very grateful for your attention on this topic, There is some, everything innovation has some challenges that we have in this case. One of them is, it's something new, so we need a lot of research and investigation in order to validate our hypothesis here. We need also to get a standardization and, involvement from health authorities, so they can validate the treatments, because there is a lot of people, there are companies that are selling things related to regenerative medicine and stem cells that are not necessarily stem cells, are not necessarily regenerative medicine. So regulation is very important. And I think that regulators, especially in these times, should move more quickly than they are, not only in regenerative finance, in regenerative medicine, but also regenerative finance, also in regenerative agriculture. They have to move forward, because they are behind. So I think it's very important for us to put this topic on the top of the importance, so regulators can follow up, the possibilities, and we can work this in an ethical way. Just a little reflection. The future of regenerative medicine is about, how we deal with these technical struggles, how we can promote a healthy lifestyle, and how we can get standardization on how these treatments are, offered to the public. I'm proud to be Latin American, but I'm also very conscious about how things work in Latin America, and I think that as soon as we can put this topic in the top of priorities of stronger jurisdictions, is going to be about mainframe in the near future. So thank you very much for your attention. If you have any technical question, I'm here with the doctor that wrote the book, and there is our contact points if you want to contact us at any moment. So thank you very much for your attention.